watching by the minute as these bills change. We're actually hopeful that it will actually be beneficial to hospitals because I believe if the bills are structured as advertised, that it will reduce the uninsured, and the insured folks will stay insured, and that provides some equalization because hospitals across the country have offered some funding, if you will, some subsidy of this bill as well. And so the lower reimbursement plus the lowering of uninsurance should equalize to some degree, and we're hopeful that it'll actually balance out or be positive.
Yes, ma'am.
I think we haven't touched the fact that insurance companies are investment companies, and that they have made, whereas the hospital may not have an interest in just running business as usual, the insurance companies do. We've heard of this. We've heard of the big bonuses, despite the fact that their revenue has been reduced. They continue to give out these big bonuses, and that taxes individuals who are practicing medicine as well as the hospitals. So imagine a doctor who has their own bills, who has bills from going to school, has to pay a $60,000 insurance. Why? I just keep asking the question, why?
Again, the only problem with the healthcare reform is it doesn't address that. You know, the frivolous lawsuits really are not being addressed here. So there could be significant cuts if that could somehow be addressed.
I just want to address that response point. Bush's OMB did a study last year of office, and they have every reason to find defensive medicine, frivolous lawsuits, and malpractice insurance as to be major cost factors in the system. But they were only able to pinpoint it about 1%. So my question about this has always been, and this has been a point of contention, the impact of malpractice on cost. My question is, where's the rest of it in the data? If it's such a major factor in increasing cost, why don't we see it?
That is an excellent point. What our suspicion is, there's a lot of hidden costs that was not adequately found in the study. Things that are perceived as quality elements. People come to the emergency department who have to have a CT, for instance. The emergency department physician may say, I better, in his mind, saying, I better get all the studies done, just in case. Because if I miss something, that's going to be a mark against me and a heavy lawsuit. So over order of tests is really not an issue of a pure cost of litigation, but it's a prevention of litigation in his mind.
But the OMB included defensive medicine in the testing.
Okay. They're going to take that up in the parking lot. Okay. For those in the healthcare field, specifically doctors, hospital administrators, how often have you run into cases of those that are insured who are denied the care that you would typically prescribe if given the option by their insurance companies and have had worse outcomes than they might have had otherwise? Does that make sense?
I think all of us that practice medicine have this happen on a daily basis. I take care of tons of breast cancer patients. No one wants to pay for a breast MRI. It's very expensive. Studies show it's more sensitive than mammogram and ultrasound. Now, there's reasons not to do it because it's too sensitive. You don't want to do it on everybody. But there's really good reasons to do it, and it's very difficult to get it paid for it. I have to get on the phone all the time, every day, and sit there and argue with folks who are not doctors, usually not nurses. And the whole point of it is insurance companies know that eventually we're going to give up, and that's not really right. In addition, what we're talking about, chemotherapy drugs that probably would help folks, but they're too expensive. So I think all of us deal with this on a daily basis. I'm sure the hospital administrators deal with it on a daily basis. So it's unfortunately something that we see all the time where we're not allowed to do what we think is right. Sometimes we can make it right by making multiple calls and writing multiple letters and all that. Sometimes we can't, unfortunately.
Thank you. Another area is with the cerebral aneurysms. Typically, you cannot do a CT scan unless there are neurological symptoms. And by the time you have neurological symptoms, this person is on their way out. It is diagnosed simply by the presentation of the patient and their history and an acute suspicion by the practitioner. I've diagnosed 11 of them. None of them had any neurological symptoms. So, you're absolutely right. You would just have to go fight like a dog with these insurance companies and get it done, and boom, there it is, and you pass them on to the surgeon. So I'm just saying that, yes, the insurance companies do influence our practice.
There's also, I would think, inappropriate fraud that's going on with insurance sales tactics from time to time. We read in papers. We see it at the hospital every day, where people come in thinking they have coverage. They've been paying out, premiums, high premiums. Come to the hospital and all of a sudden they realize, unfortunately, that it doesn't cover what they are coming to get taken care of. It's horrible. It's absolutely, you pay lots of money and it doesn't even cover. So, buyer beware. In many cases, but it's very complex. Trying to read the premiums, read the insurance manuals. It is tough.
Very good. And I'll apologize to those questions I wasn't able to read to the panel. We've got approximately halfway through some of the questions. What I will ask, if the panel would be so gracious, is if you all would mind staying 10 or 15 minutes, even if you can stay 5 minutes. For those folks that may have questions that have taken the time out to come tonight from our great community, if there's a question they might have wanted to ask one of you in your fields that they didn't want read out by someone like me, we'd certainly appreciate that. I'd like to thank everybody that has come in the audience tonight. I see a lot of community members, and I see some people from the east side of the county also, and we welcome you over. So thank you again for being here, and I'd like to